You couldn't focus, you felt overwhelmed, and you were snapping at everyone around you. You're convinced it was ADHD, and so was your doctor. But when we sat down in my office to take a closer look, the real problem wasn't attention at all. It was sleep. The twist? Poor sleep can mimic ADHD so precisely it fools even trained professionals. And if you already have ADHD, it makes everything worse. And the longer it goes unchecked, the harder it becomes to untangle what's really going on, until everything starts falling apart. I see this every week in my practice, so let's break it down. And who am I to make the bed and add all those unnecessary cushions just to make it look pretty and then later just throw them on the floor before jumping into that same bed? Well, my name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And as someone who struggles with getting enough sleep and has ADHD, maybe I should take my own advice on this one. Sleep deprivation doesn't just make you tired, it hijacks your brain. First, your focus disappears. Then your impulse control vanishes. And finally, your mood falls off a cliff. Sound familiar? That's not just exhaustion, that's ADHD, or at least what it looks like. In fact, doctors often can't tell the difference between a sleep-deprived brain and an ADHD brain. Why? Because both shut down the same area, the prefrontal cortex, your brain's CEO. When that part goes offline, your ability to plan, focus, regulate emotions, and hit the brakes, gone. And if you already have ADHD, poor sleep doesn't just imitate your symptoms, it amplifies them. It also crashes your dopamine system, which is already underpowered in ADHD brains. Sleep deprivation is like pulling the plug on the very chemical your brain is struggling to produce. Let me give you these two quick vignettes. These aren't real patients, by the way, just relatable stories. So let's say Sarah. She's a college student who thought she had ADHD. She couldn't focus, missed deadlines, felt mentally scattered. But after testing, doctors found the real culprit: inconsistent sleep. Once she fixed her habits, her ADHD symptoms vanished. Mike, on the other hand, did have ADHD, but he ignored his sleep for years. When he finally tackled it, consistent bedtime, better light exposure, med timing tweaks, his ADHD meds started working like they never worked before. Because here's the thing, your brain doesn't move on from lost sleep. It tracks every missed hour. And after just 1 week of sleep debt, brain scans can look nearly identical to someone with untreated ADHD. But this isn't just about feeling groggy. We're talking real neurological changes. Memory glitches, emotional instability, weaker brain connectivity. So how do you know if it's sleep deprivation or actual ADHD? Or both? The key is timing and history. ADHD usually starts early, in childhood, and tends to stick around. Sleep-related issues often follow stress, job changes, parenting, or burnout. If you're used to focus fine, but now you're slipping, check your sleep first. If you struggled since you were a kid, you may be dealing with both, and they're feeding each other. If you've got ADHD, sleep doesn't just become harder. Your brain actively fights it. And the worse your sleep gets, the louder your ADHD symptoms become. It's not a glitch, it's a loop. Night after night, ADHD fuels poor sleep. And poor sleep supercharges your ADHD. Imagine this, your thoughts are racing as you lie in bed, spiraling from one idea to the next. You can't settle down. You're wide awake. Then morning hits. You're groggy, distracted, behind. That fog makes it harder to manage your ADHD symptoms during the day. You make more mistakes, miss more details, get more frustrated. And by the time you hit bedtime again, your brain is even more wired, replaying everything that just went wrong. That's the cycle. And for a lot of us, it becomes the norm. Studies show that up to 80% of adults with ADHD struggle with insomnia. And one major reason is something called high sleep reactivity, which means your brain overreacts to stress. A tough meeting, a skipped task, an awkward tech exchange, things that others might just brush off, can send your ADHD brain into hours of overthinking. While a neurotypical brain might let go and sleep, an ADHD brain replays it, rehearses it, and ruminates until 2 a.m. Then there's revenge bedtime procrastination, maybe the most relatable symptom of all. You know you should go to sleep, but suddenly you're scrolling, watching one more video, or deep into a random hyperfixation project that definitely didn't need to start at midnight. That behavior isn't random, it's classic ADHD. Your brain craves stimulation, and bedtime, it offers none. The problem is, all that late night activity messes with your melatonin, the natural hormone that signals it's time to sleep. Your brain sees you still going, still engaged, and thinks, oh, I guess we're not shutting down yet. For women with ADHD, sleep disruption can be even more intense. Hormonal shifts combined with stress reactivity make insomnia, hypersomnia, and parasomnias more likely. But here's something most people don't realize. ADHD doesn't just affect when you sleep, it affects how you sleep. It messes with your sleep architecture, meaning your brain doesn't cycle properly through light sleep, deep sleep, and REM sleep. So even when you do get your 8 hours, you might still wake up exhausted because your brain never reached the restorative stages it needs. And the cycle continues. But here's the good news. You can break it. You don't need to fix everything all at once. Fix your sleep, and your ADHD symptoms often start to ease. Treat your ADHD, and sleep gets easier too. Just start somewhere, because staying stuck isn't your only option. For people with ADHD, sleep isn't just fragile, it's constantly under attack. And the culprits aren't just stress or bad habits, they're real, diagnosable sleep disorders that seem to target ADHD brains more than any others. The three most common are insomnia, restless leg syndrome, and delayed sleep phase syndrome. Let's start with insomnia. It's more than just having trouble falling asleep now and then. For many people with ADHD, it's a nightly battle. Either your brain won't wind down, or you keep waking up in the middle of the night, or both. Studies show that between 43 to 80% of adults with ADHD struggle with this kind of chronic insomnia. It drains your energy, crushes your mood, and makes everyday tasks feel 10 times harder. Then there's restless leg syndrome, or RLS. If you've ever felt like your legs were buzzing, twitching, or just wrong when you're trying to fall asleep, like you have to move them, that might be it. For kids with ADHD, RLS affects up to 42%. For adults, it's between 20 to 33%. And here's what's really frustrating. When ADHD and RLS show up together, they often intensify each other. Now let's talk about delayed sleep phase syndrome, or DSPS. This one's sneaky because it just feels like your body is just on a different clock. You can't fall asleep until 2 to 3 a.m., even when you're exhausted. And when the alarm goes off at 7, it feels like your brain hasn't even started the night. Over 35% of adults with ADHD deal with this. Your natural rhythm runs hours behind what society expects. And the mismatch can make every morning feel like jet lag. But here's where it gets heavier. These sleep disorders don't just show up in isolation. When ADHD overlaps with other mental health issues like PTSD, anxiety, depression, or substance use, your risk of sleep disruption skyrockets. PTSD alone can triple the risk. Depression increases it by 73%, anxiety by 51%. For kids with ADHD, there's one more major concern: sleep apnea. The breathing stops and starts during sleep. Their brain doesn't get enough oxygen. And during the day, their focus, memory, and their behavior all take the hit. What's wild is that these disorders are both biological and behavioral. Your brain chemistry might be making sleep harder, but so are the choices you're forced to make just to get through the day. Maybe you avoid bedtime because you hate lying there awake. Maybe you're so tired you're drinking caffeine at 6 p.m. just to stay functional. And those coping strategies, they often make the root problem worse. But here's the hope. You don't have to jump straight to sleeping pills. ADHD experts recommend starting with medication timing tweaks, simple habit shifts, and powerful research-backed tools like melatonin at night and bright light therapy in the morning. That combo has been shown to reset the body clock, especially for people with ADHD-related sleep delays. And when these sleep issues are treated properly, everything starts to change. You're more rested. Your mornings stop feeling like punishment. You start thinking more clearly. And often, your ADHD meds start working a lot better too. Because when your brain finally gets real rest, the rest of your life gets easier. Most people think ADHD meds ruin your sleep. And yeah, they can if the timing is wrong. But here's the twist. In a lot of cases, the right medication taken at the right time can actually improve your sleep. I know that sounds backwards, but think about it. If you're racing thoughts, your mental restlessness, your emotional reactivity are what's keeping you awake, then controlling those symptoms might be exactly what helps you fall asleep. And for many people, that's exactly what happens. One study showed that people taking methylphenidate, like Ritalins and Concertas, actually had fewer nighttime awakenings, felt calmer in the evenings, and got better quality sleep overall. The meds didn't overstimulate their brain, they helped it to settle. But here's the part that makes the biggest difference: timing. According to the Canadian ADHD Resource Alliance, and yeah, that's a real thing, the first step to fixing sleep issues often isn't changing the meds, it's changing the when you take them. That can mean shifting your dose 2 hours earlier, or switching from a long-acting version to a short-acting one that wears off by bedtime. These seem like small changes, but for many people, they're a complete game changer. Another proven strategy: melatonin at night and bright light therapy in the morning. Melatonin tells your brain it's time to wind down. Morning light tells your brain it's time to wake up. This combo helps to reset your body clock, especially if you struggle with delayed sleep phase, where your brain wants to stay up way later than the world allows. And here's what's really wild. Fixing your sleep, even if you don't touch your medication, can improve ADHD symptoms by up to 30%. Not just because you're less tired, but because your brain is actually functioning better. Your emotional control sharpens, your focus comes back, you feel more like yourself again. And for many people, once their sleep improves, their ADHD meds suddenly start working better too. So what does this actually look like in real life? For some people, it's as simple as taking their stimulant medication a couple hours earlier than usual, just enough time for it to wear off before bedtime. Others switch from a long-acting 12-hour pill to a shorter-acting 8-hour version, so it does its job during the day, but it isn't still buzzing in their system at night. A lot of people find that taking melatonin about an hour before bed helps their brain start winding down naturally, especially when they pair it with something as simple as opening the curtains or stepping outside first thing in the morning to get that hit of natural light. These aren't massive overhauls, they're small shifts, but they can lead to massive results. So if your sleep's been a mess, don't just try to push through it, reset it. And watch how everything else, your mood, your focus, your energy, starts falling into place. Here's the part most people miss. Sleep isn't optional when you have ADHD. It's not a bonus. It's not a luxury. It's the foundation. When your sleep falls apart, everything else does too. Your focus crashes, your mood gets more reactive, your meds stop working the way they're supposed to, and you start thinking this just might be who you are. But it's not. You're not lazy, you're not broken, you're likely exhausted, and your brain's been stuck in survival mode. So here's a small step that could change everything. Track your sleep for just 1 week. Write down when you go to bed, when you wake up, and how you feel each day. Then bring that data to your doctor, your ADHD coach, or your therapist. That one step might uncover a pattern, and that pattern could be the key to unlocking better sleep, better focus, and better overall brain function. If you want to go deeper into what actually works for ADHD brains and sleep, I had an amazing conversation with Dr. Kristen Casey, a clinical psychologist who specializes in this exact thing. We talked about why traditional sleep advice often backfires for people with ADHD, how to spot sleep disorders that most people miss, and the habits that actually move the needle without relying on meds alone. You can watch or listen to the full episode right after this. It's linked here on screen and in the description. Until next time, be safe, be well.